Let's go. Here's the first one. We can't trust COVID-19 vaccines because they were rushed. Doctor?
They were made very rapidly, but let's put this into perspective. This is a new technology. New? Actually, we've been working on this new technology for 20 years, so it's not so new. And now along comes COVID. We have this pandemic, and all the resources, private and governmental, were put together to create this vaccine, yes, in a very rapid fashion, but it was intense. We did some things simultaneously that are usually done in sequence. Let me give you one example. If you were the CEO of a large vaccine manufacturer and you had a new vaccine and it went into a clinical trial to see whether and how well it worked, well, you'd wait for that trial to be finished and show that the vaccine worked before you started to manufacture it in millions of doses. Because obviously, if the vaccine didn't work, you wouldn't manufacture it. But we didn't do that. You and I, as the taxpayers in the United States, were so convinced that this vaccine was going to work that we told the manufacturers, while the trial is still ongoing, we're going to start manufacturing this vaccine so that as soon as the trial was over and we showed that it worked, we could start administering it. So we do things simultaneously rather than in sequence. That saved a terrific amount of time. Yes, we worked intensely and rapidly. No corners were cut. This is a safe vaccine.
So glad we got to that myth. I have a couple more, Doctor, but I just got a viewer question from Facebook from Marky. So I want to take it right now. It's kind of cute. I have had COVID and I am fully vaccinated. That's fantastic. I put my mask away. Will I live forever?
Marky, I hope you live just as long as you're intended to live. God bless you. That's wonderful. You're doubly protected, and I'm so pleased about that. Now help me. Please go out and get your friends vaccinated. I'll bet you've got some friends who haven't yet rolled up their sleeve.
Very good point. Marky, thank you so much for sending that in. All right, Doctor, another myth. Let's take this one. Some people are concerned about the ingredients in the vaccine. So we don't know what's in these vaccines. Why should we believe they are safe? Doctor?
Well, of course, the average person doesn't know what's in vaccines. Any vaccines, the vaccines we give our babies, the vaccines we give our adolescents, the vaccines we take as adults. We have to have a certain degree of trust. The trust is, first of all, in the Food and Drug Administration. They are extraordinarily rigorous in determining of what's in vaccines. Some of this is related to a concern about bad effects of the vaccine. Let me make something clear, because I get this question all the time. We don't know about the long-term effects of these vaccines. That always makes we in infectious diseases scratch our heads, because with any other vaccine that we use here and around the world, in babies and in adults, there are no long-term effects of those vaccines. Nothing that shows up 2 years, 5 years, 10 years later. The adverse effects that occur within 2 or 3 months. Those are the ones we know, and now we've given this vaccine. It must be approaching 160 million people in the United States. We know about the side effects associated with these vaccines. That blood clotting disorder was one of the ones that we uncovered. We found it even though it was a needle in a haystack. These vaccines are very, very safe.
And I'm glad you brought that up about long-term, because again, I'm going to just bring it home to a personal experience. I had both my girls vaccinated this week, vaccine number 1, and they were extremely adamant, not happy. All their friends telling them long-term effects, infertility. Doctor, can you clarify that myth, please? Because my daughters are listening right now.
Let me be serious and not at all facetious about this. There are no effects on female, or for that matter, male, fertility associated with these vaccines. The material in the vaccine doesn't go anywhere near our genetic material, our DNA in our bodies. And the American College of Obstetricians and Gynecologists, those doctors who will care for you, whether you during your fertile periods and when you have your babies, they say these vaccines indeed may be given to women who wish to become pregnant, who are pregnant, and or are breastfeeding. These are very safe vaccines for the moms, for the babies, and they will not affect your fertility. You can be absolutely sure of that.
Doctor, thank you so much for clarifying that one. I got a great question from Donna right now on Facebook. Here's her question. At my work, there's 11 people that were fully vaccinated, but yet they got the coronavirus. What do you say about that, doctor?
Well, that sounds like a little cluster, Donna. I'm not sure about that, but we know that there are going to be some breakthrough infections. We did say the vaccines were 95% effective, didn't we? I didn't say 100%, which means that occasionally this virus will sneak through and make someone ill, but those people are going to be less affected. Here's a cluster I know about. In the New York Yankees organization, there are 7, I think that's the right number, people who have been fully vaccinated and have been infected. Now, mind you, only one person has symptoms. Those symptoms lasted 2 or 3 days, not nearly severe enough to go to the hospital. All the other people, even though they tested positive, have no symptoms whatsoever. That's the vaccine working. The vaccines were designed to make our illness so mild that we didn't have to go into the hospital. On occasion, someone will get an infection even though they're vaccinated. Pretty unusual.
Indeed. Doctor, I want to get to one more myth, and this is one that I hear a lot of as well. And let's take that if we can. Some people who have had COVID-19 infections said it wasn't so bad, and many never got infected. So if the survival rate is so high, why should people get vaccinated, especially young, strong individuals? We kind of talked about that a little bit, doctor, but I just want to debunk that myth.
So the question really has to do about younger people, younger adults, and now, of course, we're reducing the age down to what we call children. It's down to 12 years of age, and studies are underway about vaccinating grade schoolers and even preschoolers. So why should we vaccinate these young people? We know that they are less apt to have serious disease than are adults, but some of them do get serious disease. The CDC has recorded about 1.5 million cases of COVID in children, about 13,000 hospitalizations, and something on the order of 300 deaths. So on occasion, this virus can find a younger person and still make them very, very sick. So we want to protect them. And of course, by protecting them, they also contribute to community immunity. They help make the entire population safer, especially those schools. And they'll be going back to schools, those 12 and olders, vaccinated this fall. That should make the parents happy and all the teachers and other adults in the school happy.
Thank goodness. Speaking of going back to school, what are your thoughts on traveling over the summer, doctor?
Travel with care. Travel when you're vaccinated. That's the best time. I wouldn't worry so much about being on an airplane. They handle the air and filter it very well. But buses, trains, you can get very close together. And remember, in airports, keep your mask on, keep socially distant, And then where is it you're going? Are you going to visit some relatives? Can you make sure they're vaccinated before you get there?